Getting in and out of bed and sleeping positions is one thing that no one ever tells you about after a rotator cuff repair, and it's so important for your recovery. My name is Huang. I'm an occupational therapist and certified hand therapist, and in my clinic here in Miami, recently had a patient after a rotator cuff repair come and tell me how she was told just go and sleep in a recliner. And I'm gonna share with you why that is so terrible and show you some ways in which you could get in and out of bed and position yourself in a way that's going to help you with your recovery. There's no way your neck and your shoulders are not connected. We share a lot of the same muscle connections, so the muscles in the front all connect to essentially our belly and our pelvis, right? And the back muscles connect to your lower back. So if you want to recover faster and you want to recover with less pain after a rotator cuff, if you sleep in a recliner, which I know is easy to get in and out of, it's going to kind of put you in a very slumped over position, which means you're just going to be real tight right here and overstretch over here. And it's going to put you in a position that makes it much harder for you, and it's going to make your recovery so much longer. That's my piece on recliners. If you're gonna sleep on one, do what you need to do. But let me share with you how I teach my patients how to get in and out of bed so that they don't have more pain, and it helps them overall in their recovery process and in the therapy. Let's pretend that your shoulder, well, I'm gonna pretend that my shoulder had a repair over here. If I'm wearing my sling, right? So this is something you can do in the first 4 weeks after a repair. So the first 4 weeks after the repair, you're probably still wearing your sling, and you wanna be protective of that shoulder so that you're not trying to move it and trying to pull at that repair. It needs a little time to heal. So if you're wearing your sling, you want to keep it on for right now. And this is how I'm going to show you how to get in and out of bed. When you have it on, you're going to make sure that your hand is just on your belly, right? Just have your hand on your belly. And if this, I'm going to pretend that it's my right arm. So if you go and go down into bed on your right side, guess what you're doing? You're putting a weight through your elbow. Did you know you're not allowed to put weight through your elbow into your shoulder in the first 4 weeks? Don't do it. So the best way to do it is to actually go and lay down on your left side instead. So pick your side. For demonstration purposes, I'm just gonna go on this side, just so you can see me. This is my camera angle. I love a handy dandy towel roll in order to help me position my arm. I love positioning it so that when you lay down, your arm doesn't just fall back like this, and then it causes even more stretch and more pain into this area. So I put a towel roll, I get a towel roll, and I put it wherever I think I'm gonna land with my right shoulder, right? My hand goes onto this, my shoulder that I had surgery. My hand's gonna go onto my belly, and I'm gonna go down on my left side. So I'm gonna go down on my left side, and I'm gonna put weight through my left elbow, and then I'm gonna bring my feet up, and then I'm gonna roll back onto my back. When I roll onto my back, my towel roll is gonna be right there, and it's gonna hit me right here at the bottom of my elbow, right? And then now I'm on my back, and I can lay down like this, right? And here's the thing, your sling is still on, but you can loosen it around your neck so it doesn't pull on you. So you loosen it on your neck, and then that way your hand can just be wherever it be, so it's less constricting and you can sleep. When you get up, you're gonna bend your knees, hand on your belly, and you're gonna roll over onto your side and push yourself with that left elbow. And then in this instance, you can now fix your sling and tighten it up so that you're not really moving that shoulder and you're not putting weight through it, right? Let me show you what that looks like if it's my left arm. Well, let me show you what that looks like with a towel roll. So let's pretend I got in on the other side. I wanna make sure that towel roll hits me right underneath the elbow, and that way it supports my shoulder and it falls back, and I'm gonna loosen up my slings so that I can just relax my elbow, right? And my towel roll supports my shoulder. That's the best way to get in and out of bed and also position yourself right after a rotator cuff repair. Now, if you didn't have a rotator cuff repair, but you had other shoulder surgeries, this is the same thing This is the same thing that you can, that can help you get in and out of bed. If you can't put weight through your shoulder, if you just had a surgery, and usually you want to follow that type of getting in and out of bed and positioning for the first 4 weeks. After 4 weeks, you're allowed to do a lot more stuff. You're allowed to start moving it, and then you don't have to be as mindful if you are less painful. But my husband had a shoulder injury a year ago, or was it 2 now? And this is exactly the same way I taught him and positioned him so that we could make a faster recovery. And amazingly enough, he did really well just from positioning to make sure that we control the pain. Because if you can control the pain from the beginning, you don't fall into a pain cycle and start, once you fall into a pain cycle, it becomes much harder to get out of. So this is why the first phase after surgery is so important to get right. If this video helped you or you have more questions, leave me a comment below.